A California grant that has shown positive impacts on tackling the opioid crisis is running out, and community groups that directly benefit are now fearing the worst. In 2019, lawmakers approved funds for the California Harm Reduction Initiative, which provides more than $15 million to dozens of programs that help provide services to people addicted to drugs. Groups using that grant money to pay staff instead of relying on volunteers. Well, dedicated staff are able to reach more people, providing them with the life-saving medication, Narcan, and more. Well, now Governor Gavin Newsom is proposing a plan to use hundreds of millions of dollars to help provide free Narcan to more people, but it does not include more funding for these grant programs specifically. And as a result, some of these community groups are pretty worried about their livelihood and being able to provide the life-saving treatment. Joining me now, Executive Director of the Sierra Harm Reduction Coalition, Tom Ewing. Tom, appreciate you being here this morning. What is your biggest concern right now when it comes to the allocation of funds and for you and your team to do the work you're doing?
Morning, or hello. Simply said, the grant provided by California, the California Harm Reduction Initiative, also known as just CHEERI, allowed us to, in essence, survive. It paid for our staffing and a lot of supplies for our community, including large amounts of Narcan. And without those funds, essentially, we close our doors. And we will not be able to support our community.
Isn't it a good thing, though, just to help me understand the approach here, that Narcan would be freely available so that more people could have the treatment?
Yes. And in fact, one of our primary focuses is getting Narcan on the street with zero barrier. So anybody who desires Narcan, we provide it to them. We will even deliver it to them, and as much as you want. We go to community events and hand out hundreds in a day. And you know, this is a life-saving medication that we know. Last week, we had in our neighborhood or in our neck of the woods, 6 people were revived using Narcan. That's 6 people who are now alive because free Narcan was available whenever they need it.
So the issue is not access to Narcan and making sure that it is supplied to those who need it when they need it most, but it's funding for other programs that you all provide at the Sierra Harm Reduction Club?
Essentially, it's the last mile. While right now, Narcan, I receive Narcan at no charge through the state. This is a wonderful service. Not necessarily a part of CHEERI, but it is another program. But the last mile is, how do you take thousands of doses that are free and actually get them into the community that needs them? We are the last mile. We are the people who touch the box last before it gets into the into our community's hands.
Understood.
So,
understood. Tell me about the use of, sorry to interrupt, Tom, but the use of Narcan, how quickly it works. We often don't hear about the immediacy of and effectiveness of this drug, and you see it firsthand. Explain what you've experienced.
My experience is, if somebody is down for the count in an overdose situation where opioids are being used, typically, one shot of Narcan will bring somebody shot, meaning ingested into the nose or injected into the thigh. Response is seconds. Sometimes you need a second dose, but again, you're looking at 1 to 2 minutes versus somebody. They are alive and awaiting medical care.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.